let's talk a little bit now about viral testing for SARS-CoV-2. So testing is something that can be very, very important over the course of detecting whether somebody has been infected with SARS-CoV-2. And viral testing specifically is checking to see if somebody is actively infected with the virus. So you're actually taking a sample from the upper respiratory tract, either the nose, the throat, the mouth, and then you're actually trying to check if there's active virus in those samples, and that will tell you whether this individual has currently been infected with that virus. There's a lot of different technologies that can be used to do viral testing, and there's a lot of different uses for viral testing. So viral testing can be used for diagnosis, it can be used for proactive screening, as well as for surveillance. So for diagnosis, of course, this is being used in a hospital setting. You have somebody coming in with all of these symptoms, and you want to understand if this person has COVID-19 or if this person has actually been infected with a different respiratory virus and is exhibiting those symptoms. A viral test in that case is being used to diagnose this person either with COVID-19 or to say actually potentially this person just has the common flu or some other respiratory virus. In the case of surveillance testing, what you're doing is actually you are using that testing to surveil your population. And that means that you're either taking just a small percentage of the population at a time and checking at some random cadence how frequently somebody is infected in that population, or you're testing the whole population at a very low frequency. And what you're just trying to understand is someone getting infected within this population? You're just doing very low sort of surveillance. And the idea here is that as soon as you do detect somebody in that population has been infected, you try to react with a much higher cadence, proactive testing cadence, to try to now squash a potential outbreak. So surveillance testing can be used in that way. And the last strategy is really proactive testing. And proactive testing is when you're actually using the testing as a active tool to try to reduce your chances of having an outbreak within a population. So this is very, very useful when you're talking about large populations, especially workplaces. When you're thinking about bringing a workplace essential workers back on site, a lot of times there's a bunch of environmental factors that have to be taken into account. You want to make sure that the office itself is not too densely packed. You want to make sure there's plenty of distance between individuals who are working together. You want to have good air flow throughout the building to make sure that there's not too much shared airspace between individuals. And of course, you do want to make sure that the individuals themselves are taking very good precautions. So they should be wearing a mask when they're in the office. They should be keeping social distance from each other. They should be washing their hands frequently. And then, of course, they should not be coming to work if they feel sick at all, no matter what kinds of symptoms they might be experiencing. Now, in addition to all of those things, you can then also deploy proactive testing as another tool on top of these strategies to help you mitigate an outbreak. So what exactly is proactive testing? So proactive testing then is making sure that everybody in your population is being tested at some pretty high frequency, such that if one of those individuals were infected with SARS-CoV-2, you could pull them out of the population quickly and isolate them and try to mitigate the potential for that individual to actually spread the virus to the rest of the population. Now, there are a couple of requirements then for proactive testing. One is that everybody in the population has to be tested. You can't just do this on a small percentage of the population. You have to do it on everyone. And two, you have to do this at a high enough cadence that you can catch people who potentially are coming in with an active infection and isolate them well before they're able to transmit that virus to too many others within the population. So those are the two main requirements. Now the question is, what is the right frequency and cadence at which to actually test these individuals? So this is actually something that we mathematically modeled in a Sears Plus model, and we did this in collaboration with Carl Bergstrom and Ryan McGee at the University of Washington. And what we did is we built this mathematical model to look at the spread of SARS-CoV-2 in a population. The model takes into account a lot of the different properties of the SARS-CoV-2 virus itself. So how likely is it to spread? How many people are asymptomatic? How long does it take for somebody to become infectious? How long are they infectious for after they become infected? These are all the types of parameters that are part of the model. And the other part of the model is actually looking at workplace structure, making sure that the individuals in the model are actually in contact with each other at the right sort of frequency that you would see in a standard workplace, and really try to mimic the structure of a population that is typical in a workplace. Now, with this model, we were able to really ask, what is the right frequency that you should be testing in order to actually be able to quash an outbreak and keep it from happening in the first place? And what we found is that you need to be doing proactive testing either once a week or even better, twice a week within that population. And that can actually help to keep this population safe while still making sure that they are productive at work. So you can have people coming to work, but also keeping them safe. What is very important here, of course, is that anytime you identify somebody in the proactive testing that is infected with SARS-CoV-2, you have to take them out of the population immediately. They need to isolate immediately. And then what's next is you have to make sure you're contact tracing that individual. So what that means is that for that individual, from the day that they got their positive test to the couple of days surrounding before they got that positive results, you want to make sure that anybody that was in close contact with that individual within your population is also isolated out of your population, because those close contacts have a high chance of having been affected, and you want to make sure you're removing them from the population before they potentially are able to spread to the rest of the population. So if you can employ this proactive testing cadence, either once weekly or twice weekly in a population, along with good environmental controls and strong contact tracing, you can really make sure that you can maintain that productivity in your workplace while also making sure you're keeping them safe.